Sarah and her husband visited Mayo Clinic several days ago. They have been dreaming of having children for a long time. But due to this partner's wife Sarah having difficulties in conceiving, they tried to get help from a doctor. Doctor has revealed that Sarah might be suffering from PCOS. Next, the doctor explains to the partners what PCOS is.
Polycystic ovarian syndrome is a constellation of symptoms rather than a disease. In a normal menstrual cycle, the brain makes the hormone GnRH which travels in the blood to the pituitary gland. The pituitary gland then releases two hormones FSH and LH, which will travel into the bloodstream to the ovary. These hormones cause about 6 to 12 follicles to be awake and start to mature. As they are going to mature, they release estrogen hormone and cause the lining of the uterus to begin to build up. Then, one of those follicles tends to grow a little faster and becomes dominant. The dominant follicles move to the edge of the ovary to produce an egg. Meanwhile, other follicles disintegrate in the next few days. After the egg is released, the follicle then seals over, called as corpus luteum. The corpus luteum starts producing progesterone. This progesterone has a negative feedback effect on GnRH to reduce it and keeps its frequency in a normal range. This egg then travels to the uterus. If fertilized, it stays in the uterus. But if not fertilized, it will disintegrate after about 24 hours and the woman will have a regular menstrual period. One of the primary abnormalities in Pcos is the abnormal release of GnRH. Instead of being released in a regular cyclic manner for an unknown reason, it is released at a higher pulse frequency. This increased pulse frequency leads to an increase in LH over FSH. This lower FSH causes the follicle not maturing enough to become functional and cannot ovulate. If the follicle is not ovulated, a corpus luteum is not created, and without corpus luteum, there is no surge in progesterone. The lack of progesterone leads to a higher frequency seen in Pcos. The follicles that do not ovulate are cysts that form on the ovary with Pcos. Multiple cysts on the ovary represent past-failed follicular ovulation events and are characteristic of Pcos. It is also an excessive LH level stimulate the Pcos cells to produce higher amounts of male-sex hormones, androgen, which leads to other Pcos symptoms like hirsutism, acne, menstrual irregularity due to hormone imbalances, and infertility because there is no ovulation.
Next, I will explain the factors of Pcos. There are three main factors for Pcos to occur, including insulin resistance, obesity and diet, and lastly, heredity. There are no exact causes or factors for Pcos to occur. However, based on some research, the main reason for Pcos to occur is insulin resistance. The statistic insulin resistant and compensatory hyperinsulinemia affect 65% to 70% of women worldwide with Pcos. Insulin is a hormone that pancreas makes. It allows cells to use sugar for our body primary energy supply. Insulin resistant means the body cannot use insulin well. If cells become resistant to the action of insulin, then the blood sugar level can go up. This can cause our body to make more insulin to try to bring down the sugar level. Furthermore, insulin level is built up in the body and may cause higher male hormone levels, which is androgen. If the androgen is high in women's bodies, they could have trouble with the ovulation, which is the process where eggs are not developed regularly and are not released from the ovary. Moreover, the other factors of Pcos to occur in females is because of the environmental risk factors, which are obesity and diet. Lack of concern about a balanced diet will lead to obesity. Obesity is an independent risk factor of an ovulation. An ovulation happens when an egg, which is ovum, does not release from the ovary during the menstrual cycle. Obesity is a common finding in women with Pcos, and between 40 until 80% of women with this condition are reported to be overweight or obese. It is now well established that Pcos represent a complex trait similar to type 2 diabetes and obesity, and that both inherited and environmental factors contribute to Pcos pathogenesis. Lastly, having a family history of Pcos may play a role in developing the condition. There is a research to identify polycystic ovaries in 61 women with menstrual disturbances, hyperandrogenism, obesity and infertility, as well as in their first-degree female relative. They found that 70% of mothers and 87% of their sister provinces were affected, showing that heredity is one of the factors of Pcos, although specific gene associated with the condition may have not been identified.
Pcos symptoms often occur in the late teens or early 20s for men. The symptom can range from mild to severe, and not all the women with the condition will experience them all. Firstly, reproductive. There are three menstrual disorders which are oligomenorrhea or irregular period, amenorrhea and monohydria. Irregular period are the period that happen less than 6 to 8 times per year, while amenorrhea is the absence of the period, and monohydria is the heavy bleeding. Second is the physical conditions such as acne, weight gain, hair loss, and hirsutism. Hair loss happens when the hair on the scalp get thin and fall out, while hirsutism is the aggressive male pattern hair growth in the woman. It may grow on the face, arm, back, feet, and abdomen. Lastly, mood change or mood swing are rapidly change in the mood. For example, there are one moment where women feel calm and happy, but next they feel tense, anxiety, depressed, or want to cry.
Now, I'm going to explain about complications of Pcos. As we know, Polycystic Ovary Syndrome or Pcos is a health problem that affects 1 in 10 women of childbearing age. The general health and appearance of women with Pcos may be impacted by their hormonal imbalance and metabolic issues. Certain severe health issues are more likely to affect women with Pcos, for instance, endometrial cancer. Endometrial cancer is the cancer of the endometrium, the lining of the uterus. Endometrial cancer is a tumor of the uterine lining's endometrium. It is the most typical kind of cancer that impacts the female reproductive system.
When the endometrium cells start to grow too quickly, endometrial cancer develops. A tumor can develop when the uterine lining thickens in certain areas. Additionally, cancerous cells have the ability to metastasize, which is spread to the other part of the body.
Next, insulin resistance is more common in women with Pcos. Although they are capable of producing insulin, they are unable to use it efficiently. Pancreas secretes the hormone insulin, which functions as a key to allow blood sugar to enter the body cells and be used as energy. Type 2 diabetes occurs when the cells of the body become resistant to insulin. Insulin resistance is a condition in which cells do not react to insulin as they should. In an effort to induce cells to react, pancreas produces more insulin. When pancreas eventually can't keep up, blood sugar levels rise, resulting in type 2 diabetes. Lastly, sleep apnea. According to a 2019 study in the European Journal of Endocrinology, women with Pcos are twice as likely to develop sleep apnea as women without the disorder, regardless of their stage of obesity. However, the risk increases with weight gain. Depending on how severe the illness is, it is characterized by brief breathing pauses while you sleep, which may happen several times throughout the night. The most prevalent kind of sleep apnea is called obstructive sleep apnea or OSA. The condition is referred to as obstructive when an upper airway obstruction causes severely decreased or non-existent airflow. The most common cause is when the pharynx or soft tissue at the back of the throat collapses while a person is sleeping.
Pcos can have significant implications for a woman's fertility and overall health. It's important to note that there is no single test that can definitively diagnose Pcos. Typically, the diagnosis is founded on the presence of symptoms, hormonal imbalances, and the exclusion of other conditions. Here's an overview diagnosis of Pcos. We begin with the medical history. A complete medical history will be taken, including information regarding the patient's menstrual cycle, which changes, and any signs of Pcos such as excessive hair growth or acne. Then, a physical examination may be conducted to assess signs of Pcos such as obesity. The healthcare provider may also examine the abdomen and pelvis for any abnormalities. Next, blood tests are conducted to measure levels including FSH, LH, testosterone, and SHBG. These tests help assess hormone imbalances commonly seen in Pcos. Finally, a transvaginal ultrasound may be used to evaluate the ovaries. This imaging technique helps identify the presence of cysts on the ovaries. The size and appearance of the ovaries are also evaluated. Pcos treatment aimed at obtaining pregnancy often consists of a combination of lifestyle changes, medication, and fertility treatments. Here's an outline of Pcos treatment options when trying to conceive. Initially, the patient's lifestyle changes may constitute the treatment. If you are overweight, losing weight through a healthy diet and regular exercise can improve your hormonal balance and increase your likelihood of ovulation and conception. A healthy diet can promote hormonal balance and overall reproductive system. Meanwhile, regular physical activity assists in maintaining of a healthy weight, the improvement of insulin sensitivity, and the promotion of regular ovulations. Moreover, medication can be an effective treatment method. Clomiphene citrate may be prescribed to stimulate ovulation. These medications help induce the release of eggs from the ovaries and increase the chances of conception. Additionally, metformin can be used to treat Pcos. This medication is commonly used in women with Pcos who have insulin resistance. It helps to improve insulin sensitivity and regulate menstrual cycles, which can increase the likelihood of ovulation. Next, we can suggest ART as a treatment for Pcos. IVF may be recommended if other treatments are unsuccessful. It involves fertilizing eggs with sperm outside the body and transferring the resulting embryos into the uterus. In cases where ovulation induction is insufficient, IUI may be performed. It involves placing prepared sperm directly into the uterus during the ovulation period to increase the chances of fertilization. In some instances, ovarian drilling may be advised. This involves puncturing the ovaries with heat or a laser, which can help restore ovulation by lowering androgen levels. It's important to note that Pcos is a lifelong condition and treatment focuses on managing symptoms rather than curing the syndrome.
In conclusion, according to the journal PLOS ONE, polycystic ovary syndrome is a condition where women have few, unusual or very long periods. It often results in having too much of a male hormone called androgen. Many small sacs of fluid develop on the ovaries. This may fail to regularly release eggs. Unfortunately, these problems resulted in the failure in fertilization. In order to help the patient that is having this difficulty, our clinic suggests the treatment to overcome Pcos for women who want to get pregnant. Firstly, the woman patient should change for a better healthy lifestyle, such as eating a healthy balanced diet. In medication, women can take medications such as clomiphene to trigger and cause ovulation. Lastly, we can suggest that the patient try in vitro fertilization IVF treatment, whereas it is an excellent option when Pcos fertility medications fail. With IVF, there are higher chances of getting pregnant with lower risks.